Hypertension is high blood pressure. High blood pressure is blood pressure greater than 120/80. So blood pressure consists of two numbers. There's a systolic, which is the top number, and diastolic, which is the bottom number. The systolic number demonstrates the amount of pressure exerted from your heart when it's pumping. So the amount of pressure exerted on the arteries when your heart is pumping. The diastolic blood pressure is the amount of pressure that is exerted when your heart is at rest. When you have a higher pressure reading, it damages the blood vessels and increases your risk for stroke, cardiovascular problems, and kidney disease. Again, blood pressure affects every organ in your body. So ideal range for blood pressure is 120/80 to 140/90. What we know is blood pressure is greater than 140/90 or 150. Above that is when the end organ damage occurs, and that's the entire reason why we treat blood pressure, is because we know that it causes end organ damage. High blood pressure is a silent killer because you can have high blood pressure for a long period of time and not know that you have it. The only time it becomes apparent is when it does damage the organs, and then you have a whole sequelae of events that come about because of the blood pressure being too high. There are no signs and symptoms for high blood pressure. Sometimes people suffer from headaches or changes in vision or bloody noses, things like that, but overall there are no symptoms for high blood pressure. You should have your blood pressure checked at least on an annual basis. I recommend more than that because it is the silent killer and you don't know you have it. At least twice a year you should have your blood pressure checked. There are several places in the community, most of the pharmacies that we have actually have an automated blood pressure cuff where you go sit down and you put your arm in the cuff and it checks your blood pressure and you get a reading. If you notice that it's consistently above 140/90 or even 130/80, that certainly warrants further investigation and you should see your primary care provider. Risk factors for high blood pressure are number one, age, genetics, obesity, lack of physical activity, all of the things that affect everyone overall health-wise. Uncontrolled hypertension can result in chronic kidney disease, stroke, coronary artery disease, heart attack, all of the above. We treat high blood pressure by initiating lifestyle changes first, including diet and exercise. Exercise is critical when managing diabetes. Even just 30 minutes of walking on a daily basis can lower your blood pressure significantly. Step 2 in that process, of course, is medication. And we start with usually one agent. Oftentimes people who have high blood pressure end up on more than one agent because each medicine works a little differently. In most cases, blood pressure can be controlled through lifestyle modifications, including lower sodium diet, 30 minutes of physical activity, lose weight or maintain a healthy weight, drink in moderation, and quit smoking.